Alright guys, is it Cheyne Stokes or is it Biots? Let's talk about how we can differentiate these red flag respiratory patterns. So in Cheyne Stokes, this is more of a circulatory cause. So think heart failure, think poor perfusion, think conditions that are causing disruption of blood flow to the medulla. So we can also see this in patients who are experiencing CO2 regulatory disruptions. We can even see this breathing pattern in narcotic overdoses. So anything where we're building up way too much CO2. So this is characterized by respiratory progression from shallow to deep breathing, back to shallow breathing, followed by a period of apnea. And it might feel very chaotic, but if you look at it progress, it's going to be a very periodic and very cyclical appearing respiratory pattern. Unlike Biots, which is far more chaotic, and it's usually caused by damage to the pons. So this is usually caused by a result of global brain damage, meningitis, ischemia caused by stroke, head injury, encephalitis, any kind of disease that causes severe swelling. So Biots breathing is characterized by a random series of deep breaths. So it's just deep breath, apnea, deep breath, apnea. Like there's no rhyme or reason to when we are going to predict when this apnea is going to occur. So that is definitely a major difference. It is way more chaotic of a breathing pattern, and honestly, it's typically associated with a little bit more sinister outcomes, especially as you start seeing more prolonged periods of apnea. We're going to see more negative outcomes for these patients.